What is the correct way to use a child's inhaler? Imagine helping a child breathe easier during a wheeze or cough. Using an inhaler properly can make a big difference in managing asthma or other respiratory conditions. The key is to use a metered dose inhaler with a spacer device. The spacer acts like a bridge, holding the medicine so the child can breathe it in slowly and deeply. This helps more medicine reach the lungs and reduces the chance of it settling in the mouth or throat, which can cause side effects like mouth infections. First, shake the inhaler well for about 5 to 10 seconds to mix the medication properly. If it's the first time or it's been a while since last use, prime the inhaler by releasing two sprays into the air away from the face. Then, attach the inhaler to the spacer securely. For very young children or those who find it hard to keep a seal around the mouthpiece, a face mask can be used on the spacer. Make sure the child's lips form a tight seal around the mouthpiece or face mask to prevent medicine from leaking out. When ready, press down on the inhaler once to release one puff into the spacer. The child should then breathe in slowly and deeply through the mouth. It's important that they breathe gently, avoiding a whistling sound, which shows they're inhaling too fast. After inhaling, the child should hold their breath for about 10 seconds to give the medicine time to settle into the lungs. If the doctor prescribed more than one puff, wait about a minute before repeating the process. This pause helps the lungs absorb the medication better. After using the inhaler, especially if it contains corticosteroids, it's a good idea for the child to rinse their mouth with water, spit it out, or brush their teeth. This step helps prevent oral thrush and other side effects. Keep the spacer and mouthpiece clean by washing them weekly in warm soapy water, rinsing thoroughly, and letting them air dry overnight. Be careful not to remove the metal canister from the inhaler and clean the opening with a cotton swab if needed. It's also helpful for parents and caregivers to watch the child use the inhaler to ensure proper technique. Healthcare professionals can check and correct their method during visits. Schools and nurseries should be informed about the correct technique to support the child during the day. Using the inhaler correctly with a spacer helps control asthma symptoms like coughing, wheezing, and breathlessness. It also reduces side effects and lowers the risk of severe attacks. Remember, proper inhaler use is a vital part of managing long-term respiratory conditions in children, and regular reviews with healthcare providers are essential to keep everything on track.